Okay, so the good news is now he's dry. He's dry. Good for you. You think, oh, I'm done. You just want to pack it in, right? Except that he's not, you can't pack it in because it's still all on you, right? If you don't take him every whatever number of hours, he's not going to be dry because it's still all on you. So we got to go to phase 2. In phase 2, he goes when he needs to go, not when you take him. Right? Now, sometimes this starts happening during phase 1. That's the good news. And of course, we talked about if that happens, you want to like make a big deal about it, right? The person still may need assistance, again, depending upon his or her motor skills, pulling pants up, wiping, flushing, washing hands, blah, blah, blah. But the person can go when he or she needs to go. So self-initiation, as I said, will often start to happen on its own. The person goes into the bathroom, and or you start noticing what I call whispers of the need to go. So the person starts doing the pee-pee dance, you know, right? Or the crotch grab dance, or starts saying pee, 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 or whatever speech you've been modeling for him during trip training, or starts like the story I told before, you know, starts taking the symbol and handing it or flipping it or whatever, the symbol for toilet that you provided during phase 1. Take any of these things as, I need to go, right? So don't wait for the person to come up to you, give you eye contact and give you the symbol. If he even takes it off of his symbol book and starts flipping it, right? Take it as, oh, you need to go to the bathroom. Okay, let's go. Right? So you need to look for these whispers of behavior, taking your hand, you know, standing by the classroom door and looking imploringly, right? Any of these things. If any of those things happen, don't ask, do you have to go? Because do you have to go to the bathroom is linguistic. I mean, the person has to know what you're saying, has to understand the question, has to know that this motion or yes will get him there, this motion or no will not get him there. So has to understand yes, no as responses. And many of our kids don't clearly have yes, no. So don't ask. If you see a signal, if you see a whisper, say, oh, you need to go to the bathroom, let's go. Right? And just go, right? The worst that happens is he doesn't have to go. He'll sit there for a while. He won't pee, and it's, you know, fine. But if you see a whisper, go. And then obviously, if peeing occurs in the toilet, big bird, right? Celebration. If you don't start seeing signals for self-initiation, none of that kind of starts happening, then you need to start slowly, slowly, slowly extending the length of your interval. So say you've been on a 2-hour interval, right? And he's really trip trained, dry as a bone for a couple weeks now, right? 90 to 100%, virtually no accidents for a couple weeks, right? You're on a 2-hour interval. So now at around the 2-hour point, you don't take him, right? You know he has to go because that's the interval, right? But you don't take him. You kind of hold back on the taking and you start looking for signals. You don't want to hold it back forever because remember, you're just giving him an opportunity to signal here. So you hold back maybe 5, 10, at the most 15 minutes. If he hasn't given you anything that looks like a signal after about 15 minutes, take him because you don't want to lose the trip training. You don't want to lose that. You worked hard for that, right? But now you're on a 2-hour and 15-minute schedule, right? And you take him on that. On trip training, right? You're still dry, that's okay. Now, after a couple days of that, you start adding a little bit more. You're trying to give him an opportunity to signal or to go on his own if you're at home. You got to create the opportunity for that, okay? You don't want to lose the gains you've made, but you got to give him the opportunity to kind of have to think a little harder. Geez, I'm having that feeling. I'm having that feeling. Maybe I should do something about it, right? So if you see even the slightest signal as you're extending the length of the interval, again, don't ask, just go. Oh, you need to pee. Oh, I see you holding yourself. You need to pee, right? Oh, I see you looking at the bathroom. You need to pee, right? Right? You may start getting a little bit of wet pants here because you're not doing what you've been doing. You're not like, oh, 2 hours, right? You're kind of giving them a little leeway. So you may see a little bit of wet pants for the first few days of this phase as you're extending the length of the interval, and that's okay if you see a little bit of wet pants. If you totally lose control of the situation and you're thinking, oh my God, I'm losing the trip training, then you've moved too fast. Maybe you've extended it by 10 minutes and you should have only extended it by 5, or you've extended by 15 and you've only extended by 10, and you got to kind of play with it a little bit during this time. It's a little bit tentative, but still, or you may be missing signals, right? The signals may be so subtle that you're missing them. Or you may be getting stingy with the reinforcer. Right? You're still big, this is still like major Big Bird, major Stephen Harper time here, right? Like this is actually more, if anything, because self-initiation is harder than somebody taking you every X number of minutes. Now you have to think for yourself. So if anything, you should up the ante on the reinforcer. Here, don't cut back, don't cut back. Right? This is a very tricky phase, and there's no kind of, it's not as step-by-step as trip training, because you have to kind of give people the opportunity to show that they need to go and then kind of help make that happen and reinforce it when it does. So it sometimes takes a little longer than trip training, and it feels a little bit less secure. But, you know, the other thing, of course, that I always say to parents especially is, look, don't let this run your life. As much as during trip training, you know, go wherever you need to go and use whatever toilet happens to be there. If you're in phase 2 and you know you're going to the mall, for example, I mean, what do most parents of little kids do before they leave the house to go to the mall? They say to their kid, go pee. Right? It's okay, do that. Say to the kid, go pee. We're going to the mall, go pee before we leave. So that you're not, you know, in the car wondering, oh my gosh, I wonder if I'm getting a whisper of behavior here. You know what I mean? Like, make it fit into your life. Does that make sense? But also, you're giving the kid a little bit of leeway here in terms of looking for him to realize that he needs to go, and not, you want to break that dependency on you, right? So it's a little tricky. Yep.
Don't you find that this is a stage often people tend to say, I don't know, it was trip training, it was all going so well, and then he just decided he didn't want to do that anymore.
Yeah, this is the phase where that's exactly what people say, is I had him trip train and then it all fell apart. Yeah, it all fell apart, but it all fell apart for a couple of reasons. There's some stuff that we do during this phase unconsciously that makes it fall apart. First of all, we go, oh well, he's trip trained, and there's no more intervals. It's like, well, he's trip trained, now he'll just magically start going on his own. No, he won't. You still are going to have to keep taking him, but the interval is going to get longer. Right, to give him an opportunity. The other thing that people do in this phase is they stop reinforcing. And that's your big mistake. They stop reinforcing. You haven't stopped reinforcing yet. That's the next thing we're going to do. We're going to fade the reinforcers. But you're not going to do that till you're done with phase 2. Right? So you can't, this is an actual phase. Right? And you're not done till you're done with this phase. Right? So you're absolutely right. People feel like it all fell apart. No, it didn't fall apart. You stopped training.
And it's not as concrete.
It's not as concrete as in this phase as it is in phase 2. Phase 1, yep. Yeah, you know, if you've worked really hard on phase one and you've got there and you've got a kid who doesn't have a good communication system for anything else, right? Like he doesn't use pictures to ask for what he wants in any other realm of life, you may be in phase one for a long time. The good news is he's dry. The bad news is, you know, it's on you. Right? And you may be able to extend the length of the interval, right? Somewhat, so that you're not having to take him as often. But, you know, phase two really depends on either him being able to communicate, in school, him being able to communicate and ask for permission to use the bathroom. Because kids in school aren't allowed to just like get up out of their seats and go to the bathroom, right? It's not at home. Like at home. And if he doesn't have that communication skill for other things, then it's going to be really hard to make that happen. Yeah, just leave it in phase one for a while, but work on communication, right? Get the speech language pathologist in, get people in and say, this kid needs a communication system, right? Yeah, because that's a really important question. Thanks for asking. Yeah, I know, the flu.
Messes it up.
Yeah.
Go back to square one?
Well, you know, if a kid gets really sick, I figure you're miserable, he's miserable, he's not in a place where he can learn. You got two options. The radical option is put the pull-ups back on and just forget it. Because everybody's miserable, and who has, you know, right? I mean, and then when he's better again, see if taking the pull-ups off, you can just stop where you got started again, right? Again, pull-ups are a signal of we're not toilet training you right now, right? That's why you can wear them at night. That's why, right? The other option is don't be that radical. Don't go back to pull-ups. Keep trying. Go back to phase one. Forget phase two. Like you cannot do a phase two kid while he's sick. But you can do a phase one kid. You can keep him dry. Right? Like phase one's always your backup. That's why I want you to have a really good, strong phase one. Right? So you know, if I take him every 2 hours, every 3 hours, every 45 minutes, every whatever, he'll be dry. Right? It's still all on me, but that's okay. He's got the flu right now. I'm mom. I'll do it. I'll take, right? But don't try phase two.
But would you adjust maybe that time sequence of when you're taking them if they're sick?
Well, again, it depends upon what sick means. I mean, if we're talking about vomiting and diarrhea and, you know, you've got more important things to worry about.
But
when they're better, yeah, go back to phase one. Get them stable on phase one again. Get them back to where they were at with phase one, right? Right? And move forward. I mean, at some point, this won't be an issue. You know, when you're sick, you don't stop being toilet trained, probably, right? You know, I mean, once a kid's really trained, being sick doesn't undo the toilet training. But if you're at that sort of fragile place where it's a little bit...
I'm thinking in the school setting when the child comes back from being sick.
Yeah, no, go back to where you were really solid and start from there again. Yep.
So I realize you're doing urination right now, and so if so happens that the child poops and has the accident pooping.
Oh my goodness, if he poops in the toilet, oh, big bird, major big bird.
No, I meant poops in his underwear.
Clean it up.
It's just neutral,
Yep.
clean it up and.
Yep.
Okay.
Yep, poops in the underwear, clean it up, no big deal. Poops in the toilet, woohoo! I mean, seriously, you just hit gold.